Wow, this African tourist I'm nauseous. I have a headache. I don't feel well. Help! Help!
Okay, I'm a doctor. How long have you been feeling like this?
I just got back from Africa a couple days ago and haven't felt anything until now.
Have you been around any mosquitoes? Because it could be malaria.
Oh my god.
I'm not 100% sure though. We'll check when we're at the hospital.
How is malaria transmitted to me?
Well, when there is an infected mosquito and it bites you, its saliva travels through your bloodstream and then eventually into your organs, which will then cause malaria symptoms 10 to 15 days later. Okay, please put your arm out so I can get a look at your blood to see if you don't have any malaria in your system. There we go. I'm gonna go put the injection in this totally legit sample. This is your blood, and then we will send it to the lab. Have any other conditions that I may need to know about?
I have a hereditary disease called sickle cell anemia. It blocks my bloodstream and causes serious pain.
Well, that's great news. You're protected from malaria.
Really?
Yes, when the sickle cell blocks the bloodstream, it also makes you protected from the disease and doesn't let it go into the body.
What else do I have?
You probably have the flu or something.
That's good. Hi folks, it's Cam, and today I want to talk to you a little bit about sickle cell and sickle cell anemia. Right here we have a red blood cell and a sickle cell. Patients suffering from sickle cell anemia will have their red blood cells manipulated and turned into a rigid sickle formation. Right here we have a person who is healthy, and their red blood cells just flow freely through their bloodstream, and we have a patient with sickle cell anemia, and their sickle cells and their blood cells mix, and when the bloodstream becomes a fork, the sickle cells collect and block any stuff going through. Sickle cell prevents malaria. When there is a country with lots of malaria cases, you will also find more sickle cell cases. Over time, due to natural selection, as time goes on, there will be less cases of malaria and more sickle cell anemia.
Sickle cell anemia impacts the human gene pool because it keeps somebody protected from malaria. So that means that when you're born, you automatically cannot be diagnosed with the malaria disease.
Thank you, and I hope you learned a thing or two about malaria.